It was released recently that Shohei Ohtani had a procedure done on his elbow, and sources currently are expecting him to play in 2024 and potentially pitch in 2025. The surgeon that performed the surgery came out and said that basically what he did was he essentially went into the elbow and reinforced the UCL, or the ulnar collateral ligament, instead of performing a total reconstruction of that ligament like is done in Tommy John surgery. Since some people may not be too familiar with the ulnar collateral ligament and its significance in throwing, I'm going to go ahead and focus on that with this video. Ladies and gentlemen, welcome to my channel. If you are not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with this channel, I take a look at sports injuries and I explain them so that they are a little bit easier to understand. I also go over what that person should expect when in physical therapy, and finally give an accurate timetable for their return. If you like this content and you want to see more of it, please hit that thumbs up and subscribe to the channel, because I will be making more videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the comment section below. So unfortunately, I do not have a model of the elbow, but what I'm going to do is essentially just pull up my sleeve and show on myself. So when we're talking about the ulnar collateral ligament, basically where that ligament is located is it's located on the inside or the medial portion of a person's elbow. It's called the ulnar collateral ligament because it's located on the ulnar side of the forearm. So we have two bones going down the forearm. On the thumb side here, we have the radius, and on the pinky side, we have the ulna. This ligament essentially is going to span from the ulna and also attach to the humerus. And the reason why this ligament is so significant in overhead athletes is because anytime you're getting repetitive stress with overhead motions, whether it be throwing or anything along that nature, you are at the risk of essentially repetitively stressing that ligament. Now we'll talk about essentially why this ligament is so important. So anytime a person is putting their arm through that overhead throwing motion, they're going to put a lot of force coming back as they cock their arm, and then as they come through like this, that stresses that ligament in both sorts of motions. So extending the arm and then throwing the arm. When we're doing that, basically the force that's applied to this elbow is essentially trying to separate the ulna and the humerus. Obviously, this can be accompanied by pain, and essentially where the person is going to feel the pain is just right along where that ulna and humerus are going to attach. So if we suspect somebody has an injury to this ligament, essentially we will palpate and kind of feel in that medial elbow area. And on the field or in the clinic, test we can do is something known as a valgus test. So essentially what we'll do is we'll grab the person's arm like this, we'll stabilize it, and we'll provide a force coming from the outside coming in, which is also acting to try to separate those two bones. We do this test in full extension and then also with a little bit of flexion, because there are a couple bundles of the ligament, and sometimes one or both of those bundles can be affected in these types of injuries. But essentially what we're feeling for is whether or not there's instability in that elbow and or if that person has pain. Sometimes these tears or injuries can be accompanied by some avulsion fractures as well. Maybe the person is dealing with one of those in one of the bones there. So an x-ray is also indicated, but in order to see specifically if a tear is indicated, the gold standard of course is the MRI. And we have a grading system for these ulnar collateral ligament injuries. They are of course grades 1, 2, and 3. In a grade 1, that's where you're getting stretching of the UCL. In a grade 2 is where you're getting partial tearing. And finally, in a grade 3, this is where you're going to get a full rupture. And a lot of times in this case, this is where they will do that full-on Tommy John surgery, because technically with that surgery, they are doing a UCL reconstruction. Once again, in this case, the surgeon actually came out and did not classify this as a Tommy John surgery, because basically with this surgery, they came in and they did some strengthening to essentially support a healthy UCL. So this isn't technically a Tommy John surgery because it's a different method, but essentially it is the same area of the arm and the same anatomical structure. Now, I know from experience from essentially seeing Tommy John surgeries, anytime a person is going to get this, there is a major recovery time for this. And this is a little bit of a different type of a surgery, but essentially it is affecting the same structure. And if the recovery time is the same as a typical Tommy John, basically what will happen is a person will not be pitching for about 1 year. So if he had it today, then that would put him at about the end of 2024 going into 2025, depending on his rehab and timetable to return. So that seems to be on par with what sources are currently saying. Now, from the Tommy John surgeries that I've seen, it does take about 20 to 22 weeks or so for them to start that phase 1 throwing program. And this, of course, is on a case-by-case basis. And because he had a little bit of a different surgery, it might be different in Ohtani's case, but typically it'll be around that 20 to 22 week period. So if we are going by that and using that as a model, then it absolutely looks like he's going to be throwing and playing in 2024. But for them to ramp up full velocity, it does take around a year time. But of course, every case is different, and in this case, because they are strengthening an already healthy ligament, it is very possible that his recovery time is quicker. So I just essentially need to watch and see his recovery, and if I happen to hear that, I'll be sure to update everybody in the comment section. So we wish Ohtani the best of luck moving forward. If you enjoy this content, I have more videos on some MLB injuries and things along that sort, so I'll go ahead and provide a link right here for that. Thank you again for tuning in, and I'll see you next time.